I'm Dr. Hesch from Hesch Institute in Aurora, Colorado. I am a physical therapist, but also an orthopedic manual physical therapist. I treat the person, and I treat pain, and I treat the nervous system, and I treat movement. I treat reflexes in the body. And in my client, I used a technique very similar to what I learned in a course called Zero Balancing. And I probably took that course, I think like 1990. I think it was somewhere in Texas. I don't really remember. But there is a technique where they take the heels and they kind of dorsiflex the foot. And if we limit the amount of tension we apply to the heel, then the first joint that we're going to distract is going to be the joint below the ankle. Okay, so the ankle joint is right here, okay, but the joint below it is the bottom of the talus and the top of the calcaneus, called the talocalcaneal joint or the subtalar joint. Okay, this is one of the most complex joints in the human body. Okay, I would name about 4 joints: the sacroiliac, the occipito-atlantal, the atlantoaxial, which is a C1, C2 neck vertebrae, and this guy. Very, very complex. So if we gap it, the joint surface is here, and it takes on this curvy shape. And then here's the medial facet, and it goes like that. But some, if you look at the anatomy, there's 2 nice studies in Journal of Orthopedics and Sports PT, one from the 80s and one from the 90s, I believe. And you'll find out there's about 3 basic different joint types, So the anatomy can be quite complex. I really like this disarticulated model. I don't even know where I got it. You'd have to do an online search, but I don't know which company. But this is beautiful. This seems a little more curvy there. No, they're pretty similar. I take that back. This one's a little more lobulated here, more, Anyway, whatever. So this one has 3 facets. But the bottom line is that it's full of incredible ligaments. It's designed for stability and for a small amount of movement. But it is just chock full of ligaments. And here's ligaments on the outside of the foot. This model doesn't have the internal ligaments, but it's very unique in that it has what's called an interosseous ligament. And that's a more robust ligament on the inside of the joint. But that being said, we could, talk about the anatomy ad nauseum and the innervation and all of that stuff. But there is a reflex, and the way that I stumbled on it was described in a general theoretical manner. But in the early 90s, I started to deepen my evaluation and treatment of the whole body, and I would screen every joint in a person's body. And then I would treat the lowest restriction that they had. And I found that when I restored movement to that joint, that the upper cervical spine would oftentimes relax. So there is a connection between that joint and the upper cervical spine, and that's called the righting reflex. And there might very well be other reflexes at play. The technique is very gentle, and so the person is laying on their back. And I come and I hook underneath the calcaneus and I traction it ever so slightly because my intention is to distract that joint. Okay? So would you come lie on your back and I'll demonstrate it? And just an FYI, the technique learned through, that I learned back in that Zero Balancing course involves a thumb on the foot, and the foot is pushed up. Okay, my technique differs in that it's just a pure downward traction. So I'm doing this and I don't even see any motion translate to the knee. So I'm just affecting this one joint. Okay, I treated her for a minute on both sides, just like that. And I would usually treat it for, 2 or 3 minutes. But my intention was just to teach her husband how to do this to her. And this can be a very nice whole body relaxing technique. And then we had you get up and walk and go sit. So we can keep her face out of the video. Go ahead and sit up, or you don't mind if your face is in it?
No, I don't mind.
All right, that's fine, go ahead. So yeah, can you tell us what you experienced when you walked and when you sat?
It felt like I was lighter when I was walking. And
Where were you lighter?
just kind of all over. I don't know how to explain it.
Yeah, so you had kind of a global effect.
Yeah.
Okay, so you felt lighter walking.
Mm-hmm.
What else?
And when I sat down, I just felt my butt didn't bother me.
You had less buttock pain?
Yes.
Wonderful.
Yeah.
Good. So, I don't know why that helped your buttock pain.
Me either.
I don't know why it made you feel lighter down here. I can tell you that the nerves that go to that part of your anatomy are primarily the S1 and S2 nerves, and maybe a little bit of S3. And those are the same ones that go on your hamstrings, partially innervate the gluteus maximus area. But those are upper sacral nerves.
Okay.
So there's kind of a nerve connection there. But it's an interesting response, and I'll just throw it out there, and it's a great stress reliever. Thank you.
Thank you.